this morning, and I know you guys are afraid of the cold, but you should look out my window. It's frosty out there. We're Frosty the Snowman a little late. But anyway, I'm from South Dakota, so cold doesn't bother me. I'm going to share my screen. We're limited a little bit here on time, so I want to just go ahead and get right into this. And so what we'll do is uh, start here and just everybody, it's challenge month, okay? So I'm trying to help you be a winner. That's what we want. But even if you don't win the big prize, you'll be a winner because you're optimizing and protecting your most valuable asset, which is your health. So today we're going to talk about optimizing Slenderiiz. And I hope you'll understand. I can't talk about everything in detail, but I can really give you some ideas. So you have to understand that Partner Co's Slenderiiz program these are healthy lifestyles. It's not a diet that improves the underlying problem of why you gained weight, which is insulin insensitivity, but we improve insulin sensitivity. But also, we're going to balance your hormones. Now, this is critical because this is what happens. Just an overall view, I look at Partner Co's Slenderiiz program as a four-part comprehensive healthy lifestyle program and not a diet. And first of all, I'm going to really focus on Slenderiiz Accelerate, which is the key. For you that aren't quite familiar with this is discipline in a bottle. Really, this is what is going to help you. I don't think there's anything tougher for a physician than to not only motivate his patients, but to have them make lifestyle changes. It is hard. No one knows it because we fail so much. It's emotionally very difficult. We get weight becomes almost a negative. We focus on that. So I try to teach my patients focus on healthy lifestyles that happen to have a side effect of fat loss. But I combine this, and this is what's critical. The drops are great, they're important. But the basis of the program is learning to eat a healthy diet that improves insulin sensitivity. Also, modest exercise that improves insulin sensitivity from a different mechanism. And again, nutritional supplementation. And this should be part of a healthy lifestyle. This is something you continue not just this month, but the rest of your life. I've always believed in teaching my patients a healthy diet. I believe in exercise, but now I strongly believe we also need nutritional supplementation. So we want to look at a problem called metabolic dysfunction. That's the new name, Todd. They're calling it. You started out as syndrome X, and then the metabolic syndrome, and then pre or insulin resistance, and then prediabetes. Now it's metabolic dysfunction. And this is a result of poor lifestyles. And I'm just going to share this chart because what happens, this chart is about 25 years. And people are going to find themselves somewhere. Now, you could go back another 10, 15 years of poor lifestyles, which is basically the all American diet inactivity. In fact, now it is found that over 50% of our people in adults in the United States today have this metabolic dysfunction or prediabetes. Uh, 30% of our children and teenagers. But what is amazing is that we don't understand it. We got to understand that you have these poor lifestyles and then you tip over into the fact that you develop insulin resistance, which basically means you're just not as sensitive to insulin as you once were. So as you become less sensitive to your own insulin, hormones go out of balance. And the first one is insulin, because the body responds to this by actually making more insulin. So insulin production goes up. That's abnormal. And as insulin production goes up, you're not as sensitive, so you got to make more of it. But also, that fat releasing hormone called glucagon, it is dysfunctional. And so we can't release fat. We hold on to fat like a sponge holds on to water. But here's the thing that physicians don't even understand much. Blood sugars stay normal. As long as the insulin production can match this insulin resistance, blood sugars remain normal. And for years, all doctors focus on are blood sugar. That's not it, because it takes 10 to 15 years of this, and you'll see in the next slide, uh, our health begins to fail and it starts to go away from us because it creates a constellation of problems as we get in this hormonal imbalance. But at 10, 12, 15 years, you just can't, the old pancreas can't keep making that much insulin, and eventually blood insulin levels begin to drop, and then whoops, there goes your blood sugar. And it's out here that we diagnose diabetes. By the time a patient comes into me, the day I diagnose them in my office as having diabetes, 60% already have major hardening of the arteries, cardiovascular disease. That's why 80% of our diabetics die prematurely. They die prematurely of a cardiovascular event, a heart attack or a stroke. Well, this has led the diabetes specialists, the endocrinologists in this country to say we should be trying to treat prediabetes as aggressively as we do diabetes. Well, how do you do that? Well, it's intensive lifestyle changes. It is the Slenderiiz program. So I want you to know that it's just not fat loss, but let's just take a look at prediabetes or metabolic dysfunction. When you tip over into this abnormal metabolic state and these hormonal imbalances, the key thing is you start gaining all this unusual weight around your middle, and you can't lose it. But it's also associated with increasing high blood pressure. Your good cholesterol starts to drop. The very bad LDL cholesterol starts to goes up. The other fat in the blood, triglycerides, go up. As you saw in that chart, eventually blood sugars begin to go up. Your risk for having a heart attack or a stroke goes up significantly. This leads to diabetes. You also, this thing we have so many people on CPAP and all this, but the basic cause is insulin resistance, prediabetes, and obstructive sleep apnea. Talk about hormonal imbalance. The greatest cause of infertility is this polycystic ovarian disease, which now we realize is the result of underlying insulin resistance or this prediabetes. So when you start to work to try to lose this central weight, that's killer fat, okay? Because it's associated with all this. So as you go into this challenge, you're not only going to lose weight, but all of this stuff is correcting. But it's because you're putting in healthy lifestyles that improve insulin sensitivity. And here is the one thing I want you to share. The hallmark basis is using Slenderiiz. Now, I want to explain this to people who may be new on this call, have not heard this, considering doing the challenge, is Slenderiiz is a combination of homeopathic ingredients. They're called drugs, and they all do different things, but synergistically, these homeopathic ingredients improve this underlying insulin sensitivity. This is the cause of all the problems. And I see this in my medical practice. Patients noting that, jeepers, my appetite is suppressed. My cravings for sugar or sweets or even eating too much, goes away using these drops. And it happens pretty much right away because there are ingredients that are strictly put in there to stop these cravings for sugar and sweets, to appetite suppress, satiety. You feel more, you just don't have to eat as much. You feel better. But also there are other ingredients that increase your metabolism, increase your energy, your focus. But others have a calming effect and improve your mood, which is very important because this is a stressful time. But all these ingredients work together to help balance your hormones. And I can't get into detail as much as I have, but there are recordings where I have detailed this balance and what's really occurring. But the other thing is, then we look at Accelerate, and Accelerate is a companion to the Slenderiiz. But this is nutritional supplements along with some amazing herbs. Now, it contains a significant amount of bioavailable vitamin B12, which is critical in improving your energy and focus. It is very important. Biotin actually improves insulin sensitivity, again, from a different mechanism. It supports your nails, hair, skin. The most potent form of vitamin C is in the rose hips, contained at high levels in Accelerate. But here's a key. We have two aromatic herbs called ashwagandha and rhodiola in Accelerate, but they have a tremendous calming effect. I see this over and over in my patients. They just can't believe how much better they feel. The stress they're dealing with, they deal better. Their mood improves. Uh, they just can't believe it. And you've seen this out there, but this is why I call this discipline in a bottle. It just comes along and helps you. And so that's what's key. This is the key. And I encourage everybody to use SlenderX and Accelerate until you reach your health and weight goals. For some of those, that might be a couple months. Others, it might be a couple years. I mean, we're talking about people losing over 100 pounds and doing this. I mean, that's a long road. But I have found in my medical practice, I keep people on SlenderX and Accelerate until they reach their health and weight goals and have firmly established these healthy lifestyles. And I'm going to briefly review. So the healthy lifestyles, are really critical to the program. This is what makes the change. The SlenderX Accelerate supports you. But when I started to look at this metabolic dysfunction back in mid 1990s, it was obvious that there was a poor lifestyles that got us into this trouble. So now I realize, and I've looked and studied the medical literature, written my books, because maybe healthy lifestyles that improve insulin sensitivity can get us out of this mess and tip us back into a normal metabolic state, which the hormones become balanced. You become just as sensitive to your insulin. The glucagon's working good. The stress hormones are settling down, and adrenaline, cortisol. So what I try to teach my patients is learn during this time how to eat a healthy diet that contains those good low glycemic carbohydrates, the good fats, and the good protein. Now, we all need this in a balance, but the biggest problem we're dealing with, we need to eliminate those highly processed grains, bread, flour, rice, cereal, pasta, along with those high glycemic potatoes and sugar. What we have found is that all of these highly processed grains actually spike your blood sugar faster than if you're slapping table sugar on your tongue. But this is done by eliminating those and realizing that you need to be eating healthy, organic, whole foods. The apple is better than applesauce. Eating all, staying on the outside aisles of your grocery store. If you're looking at a label, you're eating the wrong food. But that's the healthy diet. But here's the thing I want to point out, and I want you to look at Pure Nourish. Pure Nourish is low glycemic, it's gluten-free, soy-free, GMO-free. It's a vegetable protein. And I use this in my medical practice as a behavioral modification tool. I get my patients, actually the clinical trials, I've done 3 clinical trials under the guidelines of the FDA using this program. And we would have our participants have 2 meal replacements with Pure Nourish, 2 scoops, in water, almond milk, or coconut milk, along with your frozen fruit of your choice, and replace 2 meals. And I am recommending that you may also consider adding giving greens, getting the vegetables, or even Power Boost, which people love. But you can do this once a day with your meals. But here's the thing. It allows my patients to easily experience a healthy diet that does not spike your blood sugar almost immediately. Now, When you get started, you're going to have 5 to 10, maybe 15 days of getting out of these carbohydrate cravings and all the sugar cravings and everything. But this is a great behavioral modification tool. It's available. It's part of your food budget. You can't have a meal for less expense than this. But this is a key. So look at that. Now, the other thing you need to know is you need to be exercising, but you don't have to be a superstar. Aerobic activity improves insulin sensitivity. So I get my patients building up, if they haven't been working out, to 30 minutes, at least 30 to 45 minutes of modest aerobic activity 5 days a week. Not every day. You need rest. But it could be brisk walking, biking, hiking, swimming, tennis, anything that gets the body moving. The only thing the body cannot handle is inactivity. But it is important that this aerobic activity improves insulin sensitivity from a different mechanism. Now, eating in such a way, the whole foods, you're not spiking your blood sugar, that improves insulin sensitivity from a different mechanism. So you combine them, they work synergistically. But also, I recommend to my patients that they provide their body with cellular nutrition. And I want to define that as providing all the essential nutrients to the cell at their optimal or advanced levels that have been shown to provide a health benefit in our medical literature. Now, we have the optimals, which have been designed. If you read my books, I got 2 pages of what I consider to be cellular nutrition or these essential nutrients. But Partner Co. has put it into 2 bottles in Optimal M and Optimal V. Now, even if you weren't trying to lose weight or you're just trying to protect your health, because I talk a lot about preventive medicine, I recommend having nutritional supplementation. And the quality of the optimals is tremendous. I have looked at each and every nutrient in Optimal M and Optimal V to make sure that not only are they the best quality, that they're pharmaceutical grade, but they are in the optimal advanced levels that I've seen in the medical literature. But also, uh, we want optimal levels of micronutrients because they improve insulin resistance or improve insulin sensitivity. Grapeseed extract, vitamin E, vitamin C, chromium, magnesium, selenium. And therefore, MOA is a great option because it contains all of this stuff. And so if you look at my recommendations, I would like to see people take both MOA and the optimals. Now, if you're going to choose one or the other, I know economics is always a concern, but to me, they work wonderful together. Uh, I even have some people, because the minerals are very important, they might do MOA on the minerals if budget is a very important thing. But I know people take MOA by themselves, people take the optimals by themselves. But consider adding this because you are not going to be on Slenderiiz Accelerate the whole time. Once you reach your health and weight goals, you're going to be relying on those healthy lifestyles, and nutritional supplementation needs to be part of that. But MOA is brilliant. It's put in 35 different superfoods, along with all of these mushrooms at very therapeutic levels, and they all have wonderful health benefits. But it's easy to take. People love it, and we want to support this. But to take this along with what you're doing or adding the optimals is critical. And that's what we're trying to really promote and let you be aware of, that we have a lot of supporting supplementation. But I want to bring another one that people may not think about, and that's Restorix. I call Restorix a detox center in a bottle. Now, I used to send my patients to detox centers. They'd have to take off a couple weeks from work, spend 15 grand, and go down and be detoxed and the whole thing, come back and then build back up. Well, now I have Restorix. It contains zeolite, spirulina, chlorella, chia seed, and other nutrients, which work synergistically together They help the body remove these toxic heavy metals. But here's something I want you to understand as you're starting to lose weight. Heavy metals are concentrated within our body's fat. So as you lose weight and you lose fat, you're going to be releasing a lot of heavy metals into the body. And what you want to do is be sure you get these heavy metals out of the body. So many of the people, especially those who are losing a significant amount of weight, want to add Restorics, and at least for this short period of time of this fat loss. And so Restorics, it's the great thing is it contains zeolite, which is really unique because it is micronized, which increases the surface, but it works within the GI tract. And you have to realize the GI tract has blood supply to it because that's where you absorb the food, and these heavy metals come by. And zeolite has a natural negative charge. Well, all of these heavy metals, cadmiums, mercury, all of the lead, have a positive charge. So as zeolite passes through the GI tract, it acts like a magnet and it attracts the heavy metals, holds on to it until you eliminate it from the body. So it's something you may want to consider. Whoops, I want to actually say another thing, but it has some benefits. Because as you get rid of these heavy metals, you alkalinize the body. In other words, the body becomes more alkaline because all of these heavy metals make you more acidic. When your body becomes alkaline, you are going to be more set up to lose weight. It's a state that you lose weight much easier. And a lot of people like to use Restorics if they reach a plateau. They're just struggling, and they'll add Restorics trying to break that plateau. The reason that happens is because their body becomes more alkaline, and that's the best state to be in trying to lose fat. Now, I don't have a lot of time here, and I don't have pictures, but there are other additional nutritional products at Partner Co. That really you could consider, and everybody is different. I'm not saying do all of these, okay? I'm just saying people might think, gee, that would be good for me, or this is where I have problems. But the GI tract is a garden within, and we're finding out that all the good bacteria and all this is critical for our immune system, for fighting different things, and adding a probiotic. And probiotics is one of the best. I mean, it's billions of these really healthy, good, bacteria that we need. So that is something you may want to consider adding as you're going through this. Another one is omega Q. And omega Q is, we all know, we sometimes don't eat all the omega-3, the omega-3 essential fatty acids that are so healthy, that decrease inflammation, that improve just our health. So if you're not a great fish eater, you're in a part of the country where you just don't get enough, you might want to consider adding omega. It's wonderful. It's a very pure form of omega-3. We also add CoQ10 in it, which is critical for 90% of energy production within every cell, but it's especially important in high energy cells like our heart, the brain, and our immune system. Another nutritional supplement, Rejuvenex, is something we don't talk much about, but it has a natural green coffee bean, which has been shown to be a great adjunct to weight loss and fat loss. Plus, it's a natural form of energy. It doesn't build you up too much. You can come down off of it. You don't have the highs, you don't have the lows. It's really a great product. You feel the results almost within 15 to 20 minutes. It's another product. If you're struggling with fatigue, or you've got this, or you're hooked on all these too much coffee, or you're hooked on energy drinks, this is a safe, healthy energy approach. Now, I want to talk and finish with Sugar Stop. This is something, if you can get it, it is there. It has an effect. But I want to share how I approach and what I'm telling my patients with Sugar Stop. You know, I don't have the chart here, but when you spike your blood sugar, you overstimulate the release of insulin. And that drives the blood sugar down into the low blood sugar range. And the low blood sugar actually stimulates release of your stress hormones to try to drive that blood sugar up to normal. Well, once that comes up to normal, now that's your adrenaline and cortisol, you know, even though the blood sugar comes up to normal, you have these high levels of stress hormones in your body. And that's why we don't like a high glycemic meal or all this processed food. But that sets off an uncontrollable hunger. In fact, the medical literature shows that that sets off that uncontrollable hunger for 2 to 3 days just by spiking at one time. So everybody kind of wants to cheat. They want to do this. And what I'm telling my patients is you not only have to be worried about sugar, but you need to be worried about bread, flour, rice, cereal, pasta, potatoes, because they spike blood sugar and spike your blood sugar faster than table sugar. So how do you use Sugar Stop? Well, in your Slenderiiz and SlenderX program, you're going to get a food list, and it's a very good food list. If you stay within that food list, and this is something we developed, this is based on all my work, everything I've done over the last 25 years, you're not going to spike your blood sugar. You're comfortable, you're fine. But if you slip away from that and you want to cheat, take Sugar Stop. Now, why? Well, I don't care if you're off the food list, take Sugar Stop. It's not just for sugar, it's not just for sweets. It's if you want bread or you want flour, you want rice. Oh, I got to have that. It's anything. They all are going to set off this uncontrollable hunger. And Sugar Stop is going to allow you to cheat without setting off that uncontrollable hunger. And so that's the issue. That's where we are. So what I've presented to you today is here's the slide that was out of order. I just want to review this real quick. The health benefits of Storics. You know, as you remove heavy metals from the body, you significantly decrease the number of free radicals you produce because that's what heavy metals do. But also it causes our body to be very acidic. Removing them allows our bodies to become alkaline. We are able to more effectively lose weight when your body is alkaline. But it may help break a plateau. We've seen this in your weight loss journey. So, you know, it's something to know about. But what's the health benefits of the Slenderiiz program? Well, first of all, it balances your hormones, including your insulin levels. In all the 3 clinical trials, we measure blood insulin levels using this program, and they came down 50% within 3 months. Now that's major, but as insulin levels come down, the good fat releasing hormone comes up, but but we also know the stress hormones come back into balance. We know all the energy, everything. So it allows you to tip back into a normal metabolic state. That's what we're trying to accomplish. Now, as a physician, the key thing is, well, now I feel better about that because my patient's health is improving. Yeah, they're losing weight, but you are able now to release fat effectively and establish your healthy weight. You're going to have healthy blood pressure, healthy blood sugar levels, healthy cholesterol levels, and that's exciting for a physician. So take back control of your health. Protect your most important asset, which is your health. Now, my patients come in to me once they've been on this program, say, Dr. Strand, what's so hard about never going hungry? Because I didn't feel hungry. I actually had more energy, more focus. I wasn't, you know, I felt great. But then I saw my health parameters improve and I began losing fat and I wasn't even trying. Why wasn't I trying? Because we're not relying on willpower. We're going at the cause. And when you go at the cause, you correct the problem. So it's not a diet. Diets fail 98% of the time. But if you're thinking about it, you're thinking about the challenge, you still have a chance, consider starting the Slenderiiz program today. Because Partner Co's Slenderiiz program is not a diet. but instead healthy lifestyles that just happen to have a side effect of fat loss. Now, weight loss is great. However, keeping it off is priceless. So I'm going to stop share there, and we finished in time. Let you finish her up. Thank you very much.